People often ask me, how long will my new hip last? Or how long will my new knee last? What they're really asking is, how do these things fail? And is that still a problem? So instead of giving you that old school answer like 15 or 20 years, I want to make sure you know how failure mechanisms have changed and why, with modern materials, we're usually talking about implants that can last essentially the rest of your life. I'm Dr. Tyler Goldberg, an orthopedic surgeon specializing in concierge hip and knee replacement. For the last 25 years and 12,000 surgeries, I've seen patients literally transformed physically and mentally. I'm on a mission to transform the way the world experiences joint replacement. Ready? Let's hit it. The old era, the 100,000-mile tire. Let's go back a few decades. Early hip and knee replacements used conventional polyethylene, an older version of plastic, as the bearing surface. That's what the metal ball or metal femoral component rubbed against. Over millions of steps, that plastic would slowly wear down. It produced tiny particles, your body reacted to that debris, and over time the reaction can cause bone loss or loosening around the implant. We used to blame a lot of this on, quote, cement disease. But the real villain was polyethylene wear, not the cement. The best way to explain this is like a tire. Those older bearings were like a tire that's only good for about 100,000 miles. Eventually, even if everything else is fine, the tread wears out and you need a new tire. That wear mechanism is what drove a lot of your joint will last 10 to 15 years counseling. The problem wasn't the idea of joint replacement, it was the material we had at the time. Around the late 1990s and early 2000s, something big changed. We started using highly cross-linked polyethylene in hips and very high-quality polyethylene in knees. Cross-linking is essentially a way of locking the molecules of plastic together more tightly, using radiation and heat, so it becomes dramatically more wear-resistant. Long-term follow-up now, 10, 15, and even 20 years, show extremely low wear rates of these liners and hips, and studies with more than a decade of follow-up reporting no revisions attributable to polyethylene wear in big series. In other words, the tire problem has basically been solved for most patients. That old, slow, inevitable wear mechanism that used to limit the implant life is now pushed so low that in typical use, it no longer is the main reason hips and knees fail. So what fails in hips and knees now? If modern bearings hardly wear, what actually makes these implants fail today? When you look at current data on hip and knee failures, the big reasons are not polyethylene wear anymore. The dominant causes are things like infection. That's like where bacteria get onto the implant sometimes years later. Periprosthetic fracture, a break in the bone around the implant, often from a fall or trauma. Instability or dislocation, the idea where the joint pops out repeatedly and it feels unstable. Or aseptic loosening, which is where the implant loosens from the bone. There's a bone issue or biology issue or a rare mechanical issue. And in some older designs, metal or implant specific problems, such as metal on metal large head total hip replacements that failed for wear issues. Notice what's missing from that list of modern series. Plain old polyethylene wear has dropped way down as a cause of failure, especially in hips and even in contemporary knees. The data is questioning whether wear still limits the longevity the way it used to. So the game has changed. We aren't fighting a slow, predictable, the plastic will eventually wear out clock anymore. We're mostly guarding against catastrophic events, infection, fracture, major instability types of things. What that means for how long it lasts. This is where the answer to your question really flips. When someone asks, how long will my hip or knee last? The honest modern answer is, if the implant is well positioned, your bone grows into it, and you avoid those big complications, we don't expect it to fail from wear. For most people, especially if you're having this done later in life, that effectively means it should last the rest of your life. Could something still happen? Absolutely, yes. Infection, a bad fall, a freak fracture, those are real risks in any joint replacement. But we're no longer planning around your automatic built-in, your plastic will wear out in 15 years scenario, hips and knees specifically. For hips, with modern setups like ceramic heads on highly cross-linked polyethylene and titanium shells and stems, long-term data into the second decade shows very low wear and excellent survivorship, even in younger, active patients. For knees, contemporary reviews are literally asking, is wear still a concern in total knee replacement with modern polyethylene? Because more and more, these failures we do see are from infection, instability, stiffness, or fracture rather than the plastic simply grinding away. So the story is consistent. Older data blended in with a lot of old polyethylene showed time-dependent wear. Newer data with modern polys shows minimal wear, very few, if any, revisions for wear alone, and failure patterns dominated by those bigger, less common events. Your car tire analogy. The analogy I like to use with patients is this. The old implants were like a car with tires guaranteed for 100,000 miles. You knew at some point the tread would be gone and you'd be back for a change. That was polyethylene wear. With modern bearings, we've basically put on tires that under normal driving don't wear out in a meaningful way. So now if something goes wrong, it's not because the tread slowly vanished, it's because of a blowout, an accident, or something else entirely. In joint terms, that blowout or accident is infection, a big fall, a fracture, or something traumatic or biologic, not the plastic quietly disappearing step by step. In my concierge practice, I build everything around preventing those catastrophic failure mechanisms. Careful pre-op optimization to lower infection risk, a controlled surgical environment, and a deliberate case volume to reduce errors in positioning and stability. Thoughtful rehab and fall prevention planning to reduce fracture risk, and long-term follow-up so we can catch any early warning signs before they become big problems. The bearing surface, the poly and articulation, is no longer the weak link. Our job together is to protect the implant from the other things that can hurt it. So when you ask me, how long will my hip or knee last? Here's my straight answer. With modern materials and good technique, if your implant behaves the way we expect it to, and you don't have a major complication, we don't anticipate it failing from wear. That means for most people, for anyone, we're planning for this to be the last implant of your life. We're not scheduling a revision in advance just because of a built-in wear problem. The better question now is, what are we doing to prevent infection, fracture, instability, and all those other things that could shorten the lifespan of your joint? That's the question I designed my entire approach and my entire concierge pathway to answer. Want more on hip and knee replacement, recovery, cost, and real patient stories? Check out the playlist below. If you're trying to figure out your own next step, start with the joint quiz and contact page in the description. That's the best way to get connected with my team. If this helped, like, share, or subscribe for more straight answers about hip and knee surgery.